The Presidential Advisory Committee on the Elimination of Drug Abuse was constituted on December 11, 2018, now chaired by a former military administrator of Lagos State, Mohammed Buba Marwa. The committee was saddled with the responsibility of reducing the level of drug abuse in the country. Now, 10 months after, the committee's report is ready, of course, already submitted to the President, President Muhammadu Buhari. Now, what do we know of the report? Information gathered during the committee's engagement revealed that 14 million people are actively abusing drugs in the country. And this is like 3 times that of the global report, which is put at 5%, I think. If that is not alarming, then I don't know what is. How did we get to this point as a nation? And what can be done to mitigate this disaster? It's a time bomb, actually, waiting to explode. These are some of the questions. This, as well as more of such questions, will be coming as we look into our discussion today on Nigeria Today. That is taking a look at the drug abuse menace. Welcome to Nigeria Today. My name is Blessing Abu. Now, joining us to take a look at this report of the Presidential Committee on the Elimination of Drug Abuse in Nigeria, I'd like to welcome Otumba Lanre Pimosho. He's a member of the Presidential Advisory Committee on the Elimination of Drug Abuse, about 27 members, and he's also a former Director General, National Drug Law Enforcement Agency, NDLEA. Welcome to the program, Otumba.
Thank you for having me.
Another member is joining us on set. I'd like to welcome Dr. Abubakar Jimoh. He's the Director, Public Affairs, National Agency for Food and Drug Administration and Control, NAFDAC. That's what you know it as. Welcome to the program, sir.
Thank you.
Okay, there are 14 million drug abuse or drug users. Let's put in that perspective. That is a huge number. And like I was already pointing out, that's like thrice of what the survey for the whole world is looking at. How far-reaching is this issue? Definitely strong for us, but there are threats, definitely.
Yes. Thank you very much for having me. We were aware that we had these problems, and we were aware that it's as huge before the report came out. But we're happy to have at least evidence-based, approach to resolving the issues. It's alarming, but having got the report now, it's like you go to the hospital, you have pains, but you didn't know what the problem is, cancer, you were thinking all sort of things. Now that you are lucky you have diagnosed, the next stage is to begin to deal with it. And that is where we are. We are going to have to stop lamenting now and just face the solution. Like I said earlier today, if you have a vehicle that breaks down, do you stand by it and you are just lamenting and lamenting, or you get professionals to handle it? I think that is what you would do. And rather than before, that everybody pretends to be professionals that can solve situations for you, you will now know that this is not one of such things that you can do trial and error. So you call people who can handle it for you. And the most exciting part of it is that I went to a program in Kaduna yesterday, ROI Youth Against Drug Abuse, and they seem to be ready. Everybody seems to be ready. The man you want to help is ready. The president who is in charge says that this is my priority. So the solutions are here. I think that is glad tidings.
Okay. I know we could have overflogged the issue of what is drug abuse, what is substance abuse, but then it's still good. We still put a little of this in perspective. And good enough, we have another agency that is into this. And for most people, they believe, okay, if it's NDLEA on one side in a particular ministry and NAFDAC in another ministry, but then we need to know where and how we draw the line between what is prescribed and what is abuse.
Yeah, thank you very much. The National Agency for Food and Drug Administration is concerned about the issue of regulation of the licit, that is the legal use of drugs, and why NDLA is concerned with illicit. So, but the two are joined in the hip together because there is a thin borderline between the two. And the problem as we have it now, the whole thing is now muddled up in terms of the abuse of the licit and also the terms of and the illicit phenomenon. So that is why the problem looks very humongous. Based on the statistics that came out as a result of the national survey conducted last year, which the result was released recently, we do have a problem in our hands. And like October rightly pointed out, it is not about lamentation. It's not about romanticizing the issue. The problem now is, the issue now is solution. And all hands must be on deck because we have to confront this monster that is a behemoth that has become a national spectre haunting all of us.
Okay, why I'm still bemoaning that it will appear as if when you get wind of a particular drug or substance being abused, there is a movement to another one that you will not even think of. So our challenge is it to actually document the kind of psychoactive substance like people try to put them in that context.
Yeah, the whole problem is it used to be talking about the illicit, then now talk of the illicit. It is muddled up. It used to be a situation. Right now, there has been a paradigm shift. We're talking of abuse of cough-containing cough syrup, which was rudimentary, as it were, in the campuses, among the youths. Then from there, we graduated to issue of tramadol, and it is down the line, and also other forms of abuse of narcotics. So then down to the even the barest, the most despicable aspect of it, of going to pit latrine to go and sniff faces and excreta, lizard excreta, and the solution, name them. In fact, people even go to mix other concoctions now. So it is, the situation is very bad, and the situation is very bad.
It's getting very academic to still be defining, because now if you say drug abuse, it's being restrictive. Okay. So it's just substance abuse because they abuse anything. The powdery bone of a dead body, so that maybe 60 years buried, is now in trouble. You know,
so people go for such ones as well.
Even soup seasoning, materials. So it's getting too academic to get involved in trying to have an exhaustive list because there's no exhaustive list. As we stop tramadol, as it becomes scarce, benylin, codeine. We discovered that immediately they started mixing ordinary sweets with drinks and all that. So where we are trying to approach it from is, why do they need the substances of abuse? Why are they looking for that excitement? So the government is trying now to take it from there so that you are not only trying to get those who are already in out, but over 80% Nigerians who don't know anything about it, you don't want them to join. So provide the excitement because they will look for this excitement anyway. Provide positive excitements, provide jobs, make people feel responsible, assist families in difficult situations, like Ministry of Women Affairs, the relevant departments handling, divorce issue and family constraints and all that. So we are going to have probably recreation centers at strategic locations with programs designed by the youth themselves, so that they can take ownership of it, so that there is a replacement. Nature, you said, abhors vacuum, isn't it? Certainly. So that when you said drop drugs, I've given you something else to give you the excitement. And if you follow what we have given you, it is recognized and developed for you. From there, we can produce great sportsmen and women. And you see that we have healthy societies. Then we also want the faith-based organizations to stand up for Nigeria at this point. So that, every book says don't destroy yourself. So the emphasis are laid on this. And before you know it, these things will be reversed. It's not rocket science. It's something that have been tried in some other places and they're getting results.
Okay, there are no doubts that the report is coming up with something strong from what recommendations there are. When we get back from this break, we're taking a break to take a look at what Nigerians in the street actually feel about issue of drug as well, and what they know on what to actually do to help stop this other group, these other numbers. And then we'll take a look at the report in itself and see what other recommendations people have come up with. You're watching Nigeria Today, and drug abuse, the Presidential Committee's report is on focus. Let's get to the streets.
Currently, there is closure of border. I think that in itself is the right direction because a lot of drugs are peddled in, from neighboring countries. So by closure of the border, I think that to a large degree will curtail, some certain excesses, And besides that, there is need for awareness creation. That is very, very, very key. Going into the primary schools, to the secondary schools, really, we should really catch them young because by the time you begin to educate the little children on the dangers of substance abuse, trust me, we'll go a long way in curtailing it.
Some inhale toilet, some also take Indian hemp, some sniff, taking cocaine, and there are some drugs like codeine. Some of them take them in excess, and it becomes drugs abuse as well.
Recently, I heard of Tom Tom and is it Lacasera or something. I don't do drugs, so I don't really know. But I know of the abuses of the cough syrup and all these things. As a young person, I saw repercussions of smoking because when you smoke, your liver, your lungs, they get dark and they get black, and then you have the risks having cancer and other things. So I know that, okay, when I smoke, this is what I get. So what are the benefits? So I do the pros and the cons. You see, the cons are far more better, are far more greater than the outweighs the pros. So I decided not to do it. So the ability of an individual to discern from good and evil also goes a long way.
We know in Nigeria we have Christians, we have Muslims, and I believe that the two major religions here, no one supports evil. No one supports all those kind of something. All this taking of drugs. We preach to them, either in the church, in the mosque.
Welcome back. If you just tuned in, you're watching Nigeria Today, and we're taking a look at the issue of drug abuse. The Presidential Committee's report is already submitted, and so much revelation in what the committee guided. Perhaps let's take a look at the scope of cover for the committee itself. How wide, and what are the areas of coverage that you actually looked into?
Yeah, as wide as to put the perspective before the authorities, the right perspective on drugs. Why is it that we have agencies that have not been able to resolve the issue?
Why?
What is the problems? We're able to analyze that. We're able to get at the root of the key agencies that are involved. What has gone wrong? We're able to also see what has gone wrong with the families. What has gone wrong? What role were schools supposed to play? So you will have infusion of drug abuse into school curricula now, so that at the right age, they are already conscious of it and they are already aware. Again, the traditional council, they are meeting now all over the place. They are meeting again. Everybody is going to be brought on board. They are, like you are aware, there's going to be what is called war against drug abuse.
Yeah.
WADA, there's going to be war against drug abuse. That is the aspect that says, Nigerians, take your destiny in your hands. So, from the federal level to the state level, local government level, down to the communities, everybody will be involved.
Okay, let's raise that particular point you you pointed out. Of course, both of you can still take a look at that. I want to quote the words from the chairman of the committee, General Mara. It's a lack of cohesion and coordinated response by the different AMDAs tasked with the responsibility for addressing Nigeria's drug issue. What exactly were your findings? Well, it's your your agency is a part of it as well.
Yeah, that's basically what the committee has discovered. We have some disaggregated efforts here and there. NAFDAC is doing some bit, NDL is doing some bit, UNODC is there trying to galvanize everybody to action. And we also have some other MDAs, Ministry of Education, Ministry of Information, the Women Affairs. They also have some pockets of efforts they are making, but they are all disaggregated. They are not united.
This is frustrating for all the agencies, definitely.
It is. So now the beauty of PASEDA is that now PASEDA has now become a rallying point, having 27 members. All these clusters of agencies are now members under the same umbrella. So PASEDA is providing the leadership. So to that extent, efforts, we are trying to take a holistic look about coordination of efforts, a harmonization of efforts, so that we have a united front to confront this monster.
Is this what PASEDA is recommending?
Yes, that's what PASEDA is recommending and has actually started doing, providing leadership as an umbrella for all other agencies of government. And we, without trying to preempt, we're also looking in a futuristic sense where we have an organization. I don't want to call the name right now so that I don't take the sale out of the bag because the report has just been submitted to Mr. President, and we're not supposed to divert. It has been internalized by government, then begin to make it a public document. But for suffices to mention that we are looking at a situation where an organization that become a clearinghouse, a one-stop center organization, that every issue of drug abuse will be under that platform, not disaggregated. It will be harmonized. So that's what we are looking at. So we have a multi-faceted approach, well-coordinated action, trying to look at, like Otumba rightly pointed out, why were the existing agencies not able to have a proactive response, and we find a situation where we are today. What are the
lack
issues?
of coordination.
Coordination is one of them. Then also the existing, what are also the causative agent? Why do we have these scary statistics? How did we find ourselves here? To the extent that Nigeria has even almost tripled the global average of the prevalence of a drug abuse in the world. So these are issues we are looking at. We already have our recommendation, holistic, because we have interacted with the various stakeholders, everybody. We have spoken to everybody.
I know the
and
burden
there was also
of funds.
a field survey. A field survey was several field surveys. We crisscrossed the whole country in the last 10 months. And we've seen on the ground trying to marry the theory and practice in order to see on the field first-hand information about the severity of this problem. And we have come to a conclusion that we have a situation of national emergency.
Definitely.
We are sitting at the time bomb.
But we have a national drug control master plan. Is this be subsumed into what are the recommendations already that you have tabled?
The National Drug Control Master Plan is going to be given its right of place now.
Okay.
Because, you know, there is no problem we have now that is just starting. Everything is contained in there. The problem is that the conveying authority has not been able to live up to the expectation. Now, all that has been put together now to make it work were there before. Ministry of Health, Ministry of all relevant agencies. The difference you are going to see now is that the political will to have this issue resolved is overwhelming and very crushing.
It is.
You stand on the way of this onslaught, you get crushed. If you have any responsibility that has to do with drug, you are going to be held accountable. And it can be very, very far-reaching. Passing the buck will not help. Excuses will not work. We have seen what is done to our life. Remove Boko Haram, remove drug from the whole issue of Boko Haram, and this thing will have been forgotten. The same thing with all these kidnappers you see. Now they say bring 20 million and 20 cartons of Tramadol to get yes, because it's difficult now to get the drugs. Bring 20 million and 20 cartons of tramadol. Yes.
That's good.
Because they are finding it difficult to
actually get
have
that.
supplies now. Now customs, you can imagine how much they have seized, that the whole of West Africa will consume 10 times. Somebody shipped them to Nigeria. It is enough, is enough. That is how I can summarize it. We will not take this anymore. Border closures is reducing the inflow of these drugs now. People are groaning in the neighboring countries. What some of our neighbors cannot consume in 20 years, they have received. So on its way to Nigeria. And people just think that life is about rice, and we should just leave it like that. If there is no rice, we'll eat yam now.
Or eat corn.
It's corn now. Before, we used to eat rice in Christmas and what is the wahala? Rice.
Okay, Dr. Abubakar, let's move in more. I know some of there are other recommendations that are contained, even though you say let's not divulge everything that we have. Now, on parents' part, because you can't just be working in silos with just agencies, state governments, local governments.
Yeah.
The family unit.
Yeah, the family is very crucial, very strategic, very central to this fight. Because part of the report, we've also come to realize that there's a complete breakdown in family values across board. So, and this is a very strong concern for all of us, because some of these problems you see on the street, the abuse is lack of parental care.
Yes, and people are actually living in self-denial.
So we used to talk about the issue of maybe for the downtrodden, the poor people, and not. But it's no longer like that. It's for everybody. The elites, and because of the vicissitude of life and the economic, people are hustling here and there. People in various homes, especially the elite home, the house girl, the house boys are now the ones grooming the children. Yeah. Parents, imagining somebody leaving their home as early as 5 a.m. and they won't get back home until 10 p.m. So the parents have become like a total stranger to their children. And the house helps, who are some of them are even
under the influence
of this substance abuse, and also members of the substance that are not even yet already groomed, because most house helps are people who are already downtrodden and are looking for where to hang on, and that those are now the ones that are now training these children now. So that is for the elite home. Then to talk of the lower rung of the society, people on the street, the statistics we're talking about over 14 million of drug users. And we also discovered that almost we have about over 10 million, about 30 million out of school children, and 10 million of that 13 is they are almajiris. So part of also the recommendation of the PACEDA, we are looking at it holistically on how we can reform the almajiri system and see how it can be responsive to the modern 21st century system, so that we can take these children off the street and also prevent more coming onto the street. Okay. So the problem is so we're even looking at our cultural values. And we were in Kano, and we were very impressed that we already, like Otobas rightly put, a traditional institution, the traditional rulers are now in the forefront, particularly the Emir of Kano leading the charge and making some kind of inspiring statement on how we should readdress, take a close look, a systemic look at our social and cultural values that tend to predispose people to issue of drug abuse.
All right. Finally, from Otumba, moving forward, yes, implementation has always been a problem for most of the laudable things we come up with. I know this is not just going to go the way of the other ones, like already you pointed out.
Blessings.
How soon do we begin to get everyone on board?
You just be patient a little bit. You will see successive, sustainable steps, programs that will be all involving. I just mentioned to you now the children, the youth will be made to face their own program, design it, and we'll run and manage it with professionals in charge. Again, we're going to have people to account. For instance, the response agencies. You will not be there unless you merit a place. And you will not be there if you are compromised. You will not be there if we cannot trust you. It's a holistic approach. Then all the efforts that were concentrated only on some supply reduction,
Yes.
forgetting how to handle the demand reduction, it will be balanced. A situation where you find NDLA alert at the airport, but you can go to Wuse 2, you can go everywhere within and just airport? No. How many Nigerians go to the airport? So we want to take care of our home. Charity begins at home. Before you say, I mean, where is the world when these small countries around Nigeria were amassing and gathering all this tramadol thing? Where were they? So they should be patient. We want to clean our house. People should be patient, because if they continue to encourage problem in Nigeria, and it will burst, we will take over everywhere, because they cannot throw us away.
Exactly.
You understand? So they should allow us sort ourselves out. They will come back later. The area
Open up to the world.
continues.
Otunba Lanre-Ekwumisho, a member, Presidential Advisory Committee on the Elimination of Drug Abuse, and former Director General, National Drug Law Enforcement Agency. Thank you for coming on the program. I also like to appreciate Dr. Abubakar. I know you wanted to say something, but really have to go. Abubakar Jimoh, Director, Public Affairs, National Agency for Food and Drug Administration and Control, NAFDAC. Thank you for your insights on the program.
Thank you.
And you're also, of course, member of the Presidential Advisory Committee on the Elimination of Drug Abuse. And okay. That's Nigeria Today for today. Thank you for watching. Let's keep our eyes open and let's fight the drug war together. It is a time bomb, at least from what we've heard. Let's everyone join hands to actually do that. Nigeria Today returns on Monday, 7:30 in the evening. To join us then. My name is Blessing Abu. Goodbye.